Hello, everyone. I'm David Wessels and supervised by Efstratios Gaves and Eric Beckers. In collaboration with Ellogon, we worked on incorporating geometrical deep learning within computational histopathology for immunotherapy. I will talk shortly about the work that Ellogon does and afterwards about the project funded by ELISE. First, why computational histopathology for immunotherapy? Cancer is the second leading cause of death globally. A few years ago, immunotherapy was introduced as a cure against cancer, where immune cells of patients are triggered to fight against the tumor cells. For some cancer types, immunotherapy seems to become first in line of treatments, with survival rates 3 times as high compared to other treatments. Even though immunotherapy is successful, medical specialists have a hard time in selecting the right patients that will benefit. To check whether immunotherapy fits a certain patient, doctors need to analyze gigapixel images of tumor tissue called whole slide images. Within those images, they look for certain biomarkers. The doctors don't have time to analyze the whole image, so they often analyze certain interesting regions. And because they only analyze regions, currently, of all patients selected for immunotherapy, 30% is a false positive and 50% a false negative. So there's a lot of room for improvement, and the benefit of computational methods is that they are very fast at inference and therefore able to analyze the complete whole slide image. Lately, a lot of research is done into deep learning methods able to analyze whole slide images for pathology. Convolutional neural networks are in general the method of choice to solve complex image analysis tasks, in part due to their translational covariance induced by trainable convolutional operators. For deep learning models, invariance to irrelevant factors are a desirable property. For example, within histopathology, image analysis problems require processing a digital slide of stained specimen, whose global orientation is strictly arbitrary, just as during the preparation workflow in the lab. Therefore, we like to create models which are also irrelevant against transformations of the global orientation. Progress in geometric deep learning has shown the power of proactively equipping models with other geometric structures as inductive bias. For this project, we worked on incorporating progresses in geometrical deep learning by implementing models equivariant against global rotational and translational symmetries within the histopathology pipeline of Ellogon. To create an equivariant convolutional neural network, we utilize the ESCNN library, which is produced by Gabriele Cesa, Leon Lang, and Maurice Weiler, which are PhD students of the UVA. We used EN equivariant operators to create steerable ResNet implementation, which is equivariant against translations, rotations, and reflections. We started using the steerable ResNet in the whole slide level prediction task of microsatellite instability prediction, which is an important biomarker for immunotherapy. We also started using the steerable ResNet as a backbone of our detection pipeline. However, proper evaluation is still necessary, and we will continue working on gathering those results. I want to thank ELISE to grant me the opportunity to work on such an interesting fundamental work while incorporating it directly into the industry. Also, alongside Ellogon, we want to thank you for listening and have a great day.